Good evening. First and foremost, thank you for joining us this evening, whether in person or virtual, to celebrate MCHC's 30th anniversary. Thank you also to the individuals and businesses who provided an amazing lineup of auction and raffle items for tonight's event. Your generosity is greatly appreciated. As a reminder, both the silent auction, the raffles, and the wine pool will close at 8 o'clock. So check your bids and enter your raffles before the time expires. Our MCH staff is in the atrium to assist you. I also want to bring your attention to our giving tree, which is in the corner of the ballroom. A beautiful tree with donation tags for needed items for the organization. So please take some time to visit the tree. It'll be available all evening, and there's a QR code on the back of each tag for your donation. For those of you whom I have yet to have the pleasure to meet, my name is Elizabeth Pulasic, and I serve as MCHC's board president. On behalf of the board of directors, we are very excited to welcome all of you to tonight's event. Personally, I'm excited to share with you a brief account of efforts recently undertaken by our MCH staff and leadership team. It has been a time of opportunities, challenges, and change, all of which have allowed both our staff and our organization to grow. Through an extensive and collaborative process that involved our staff, volunteers, committee, and board members, MCHC developed a new 3-year strategic plan that was set into motion at the beginning of this year. Our strategic priorities include financial sustainability, diversifying and stabilizing our revenue sources, and further developing financial projections, marketing development, establishing a clear and consistent message, as well as amplifying our mission, and excellence in programs, which creates an implementation of an effective program evaluation system, and also increasing operational efficiency through technology. As we work towards these goals, I'm excited to share with you an important aspect of our plan, MCHC's new logo. The illustration shows 2 feet, a child's and a caregiver's, forming a heart. The caregiver next to the child reinforces the idea of support and safety, empowering and guiding the child. The heart is a representation of health, happiness, and love, all the principles driving MCHC's mission. You will see our new logo on our materials and out in the community going forward. Inspired by the outpouring of support and appreciation from community members, peers, volunteers, board and committee members, and of course our participants, the MCHC team continues to build upon our successful track record and to discover new ways that we may further develop and deliver our mission throughout Chester County. I am tremendously proud of the MCHC team. They are the heart of this organization. On behalf of our board members and staff, I want to take a moment to thank our sponsors and individuals who supported this evening's event. Special thanks are extended to Robert and Jennifer McNeil, Bentley Family Fund, Jeffrey and Pam Breyer, Countryside Consulting, Kreischer Miller, Sandra B. Nichols, Independence Blue Cross, Keith and Leanne Sullivan, Malvern Bank National Association, Thomas and Margaret Ravello, Health Partner Plans, C&D Schneider Family Foundation, the Fund for Women and Girls, Chester County Housing Authority, Sweet and Pasturek, BBD, Homelight, Rothwell Document Solutions, Dress for Less Walls, and Enrique and Melena Lance. We would also like to thank the violinist, Belmary Lorcas, photographer, Carlos Cruz, decorator, Margaret Frostier, videographer, For Pause, and DJ Papo for their contributions to this evening's event. Lastly, I would like to thank MCHC's event committee members. Committee Chair and Board Member Allison Richards, Natalie Codlin, Leanne Sullivan, Pam Breyer, Dr. Tiffany Cook, Rebecca Poles, Dr. Kirby Wyckoff, Margaret Schneider, and Melena Lance. Thank you again for your continued support and for taking the time to be with us tonight. At this time, please join me in welcoming MCHC's Executive Director, Melena Lance, to the podium. Melena will share more about how we are furthering our mission.
Thank you, Elizabeth. So good evening, everyone. It is great seeing everyone tonight, and we're so glad for the opportunity to celebrate the last 30 years of serving our community together. We also like to welcome the guests that are joining us tonight online, remotely. We want to welcome you for being here with us. So as Elizabeth mentioned, and as many of you know, I am Melena Lance, the Executive Director of Maternal and Child Health Consortium. And it has been a pleasure for me to serve as the Executive Director for the last 5 years. And also I'm having a great experience for over 12 years as I was the Director of Programs and a manager for many, many years, since 2004. So as Elizabeth mentioned, this last year and a half has presented some unique challenges for us. MCHC was one of few human service organizations that was able to continue providing services uninterrupted, not even for one day during the pandemic, benefiting thousands of families and children across Chester County, and it is all truly because of you. Thank you. Thank you for your support. I'm so grateful to have the opportunity to celebrate our 30th year anniversary. This is a significant milestone for any nonprofit, as nationally 30% of nonprofits only last about 10 years. This milestone is truly a testament to the feasibility of our organization, our mission, and the individuals who has contributed along the way. I consider myself completely blessed to be part of an incredible and passionate team that meets women and caregivers where they are, and always with the goal in mind to support them, to support our program participants day by day. In 1991, Maternal and Child Health Consortium, MCHC, was created in response to a county health needs assessment conducted back then. This assessment revealed that there was a heavy need for accessible prenatal care services for low-income families. And as a result, a group of volunteers and stakeholders adopted the prenatal home visiting program that is based on the Promotora model and started receiving women and families and serving women and families in need. This grew with time to be what is known as our Healthy Start program. Our most significant achievement to this day has been driving down the infant mortality rate and other risk factors to below the national average. At the same time, we know that barriers to quality of life for women and families, the families that we serve, has not disappeared. Families continue to live under the comorbidity of structural racism and face barriers related to poverty, education access, language, and culture. This year, we had the opportunity to start a collective impact model by leading the Perinatal Periods of Risk project called PPOR. We're very proud to, after many years, being able to be the lead agency collaborating with the state of Pennsylvania to implement this project, the PPOR, in Chester County and in some parts of Montgomery County. PPOR is a comprehensive approach to helping communities use data to reduce infant mortality in areas with high needs. This project brings local health providers, universities, and other stakeholders together to come up with ways to improve current systems based on local vital records, data, and feedback from mothers of our community. Also this year, we were blessed to have the opportunity to start a new initiative called Plan of Safe Care, called POST. And this is in collaboration with Chester County. We collaborate with other social service agencies and medical institutions to ensure that substance-affected infants and their families are identified and offer appropriate support. We're also implementing a new database system called Apricot that will give us a more clear view of our performance measures across all programs. It will allow us to improve the way how we understand our impact and to better tell our story. In a typical year, MCHC's team served nearly 5,000 individuals across all programs. So far this year, 190 prenatal and parenting women has benefited from MCHC pre- and postnatal health education, health risk screenings, diabetes prevention education, and resources through the Healthy Start program. And 175 babies were born healthy and with a strong support system. In the last year and a half, especially, the Family Benefits team has surpassed the projected number of individuals enrolled in health insurance and food benefits, with a total of 2,375 uninsured individuals. Through the Family Center program located in Southern Chester County, 110 caregivers and preschool-aged children benefited from ongoing school readiness activities. In the life skills, diversion, and family group decision-making programs, we serve 55 caregivers with adolescent children that benefited from services that help build a safe and secure environment. I have the pleasure of working with a team of such dedicated and smart individuals who make a healthy start and bright future possible for families and children every single day. I would like at this time to ask all MCHC staff members to stand so that you can be recognized for the incredible work and dedication to the families that we serve. And I would also like to ask our board members and committee members to stand, because we would like to express our gratitude for your time, your talent, and guidance to drive MCHC into the future. We deeply thank you all for all the support and time that you dedicate to our organization. And thank you to all of you for being here with us tonight. We have a beautiful weather, and we've been expecting this day for more than a year, as we had to cancel our event last year. So I wish you to have a great time tonight. Enjoy, and thank you again for being here with us. I would now like to invite to the podium PA State Representative Chris Sappi and Diane Herring to express their remarks. Thank you.
It's so great to see you all here tonight. You clean up really well after 18 months. This is my colleague, my friend and colleague, Representative Diane Herring from the Westchester area, and we're both really happy to be here tonight. And I'm going to put on my reading glasses here for a quick moment. Don't want to stand between you and your food. But we want to thank MCHC for the vital role that they play to ensure that all children in Chester County have the best start in life, and families are empowered with tools to help them overcome barriers to building a healthy future. I'd like to speak really briefly, since we didn't have a chance to do this earlier this fall, about some legislation I've been working on, and then Diane's going to talk to you about some of the good work she's doing in Harrisburg as well. Catching my breath. And the fogging. I am the prime sponsor of House Bill 642, which was reintroduced and referred to the House Insurance Company in February. The goal of my legislation is to ensure that all Pennsylvanians have access to telemedicine. I think a lot of us have taken advantage of that throughout the pandemic, but it became very clear how important this was to people who lack transportation and need access to care. Unfortunately, Pennsylvania is one of a handful of states that do not require insurers to cover telemedicine. You're probably familiar with the concept, as I just said, but it also expands the reach of healthcare services to patients who would otherwise be unable to access it. And I've talked at some point with a lot of folks who work in behavioral health and a lot of occupational therapy, speech therapy with small children, and it was particularly helpful to have access to telemedicine for them. And this is something that we'd love to see continue, because a lot of families will miss an appointment if another sibling is sick or they're having car problems or something. These children who need these early interventions frequently will have a much more consistent treatment if they have access to telemedicine. So I was really pleased to hear that that's been an improvement that came out of the pandemic, and I hope to see that continue. The other piece of legislation that pertains here is House Bill 641 for family medical leave for all Pennsylvanians. This legislation is in the House and Labor Committee right now and provides up to 6 weeks of protected, unpaid leave for employees caring for children and other family members with a certified terminal illness. And this was brought to me by a constituent many years ago, actually, when I was still a staff person. And as we all know, families look very different. And we need access to be able to care for somebody who's terminally ill in the family, regardless of the role in the family. So I'm hopeful that that will take effect at some point in time. So I'm going to turn it over to Diane now, and then we have something special for MCHC.
Thank you, Representative Sappi, and thank you for having us here this evening. I just wanted to thank the Maternal Child and Health Consortium, because I think the approach you take is fabulous and so effective, the way you lean in to the family. You don't stand and wait for the family to come to you. You have such a holistic and cultural approach to caring for families, and you've been so successful, and I know we all really appreciate your efforts greatly, so thank you so much. I wanted to talk just very briefly about some of the work I'm doing to try to help in Harrisburg. We all know that the first 5 years of a child's life are some of the most formative in terms of development and brain development. And one of the first things I learned as a new legislator is that our early childhood education system is in absolute crisis. And we have to fix that because we have to give our families the tools that they need to have their children cared for, especially when they need to work. So I held a public policy hearing, and I'm currently working on a package of legislation that aims to do a number of things. One is to provide a much more sustainable funding model for childcare and early childhood education. And the other is to ensure that we pay these professionals what they deserve. The current crisis that we're facing is due in part to a staffing shortage, because you could go to Walmart or Target and you could get paid a lot more than you can get paid as an early childhood educator. And to me, this is so wrong, because what kind of a message are we sending that it's more important to our society to work at Target than it is to care for our children and nurture our children? So I'm looking to develop a more sustainable and stronger funding mechanism for early childhood education, and to link that to quality of programs. And also to provide some metrics and tracking so that we can show that high quality early childhood education programs actually lead children on a path of success through their K-12 years and beyond. We have the military, which is currently calling for this kind of legislation across the United States, and we have the Chambers of Commerce also calling for this kind of legislation, because it's that important to our families, our children, our society, and our economy. The other thing that I'm working on, and I know many of us are trying to work on this, is to increase the minimum wage in Pennsylvania, which is currently $7.25 an hour, so that those who work can earn a living wage and they can afford to put a roof over the heads of their families and to feed their families. This is all really important work, and I look forward to continuing to advocate for our young children and our working families in the years to come. So thank you again, and we have one more brief presentation for you.
I just have to add on her work on child care. At this hearing that she held this summer, the one distinction that was made that I think is so important for those of us who think about early child care, we're not really thinking about it in right terms. It's not babysitting. It's child care. Some of them are infants, but a lot of them are toddlers. And as she said, our chambers and our military are saying our young people are coming out not prepared. A lot of the people that are trying to get into the military at this point are being turned away because they lack so many social, emotional skills. And so our child care system is very, very critical. So I'm so grateful she's working on this. So I just had to add that plug for her work there. Anyway, but now what we'd like to do is we'd like to recognize MCHC's 30th anniversary with a citation from Diane and myself that we had drafted in the House of Representatives. So, Melanie, would you like to join us? This citation is drafted in the House of Representatives and entered into the archives, so the recognition of 30 years of service to the community becomes part of Pennsylvania's history. So thank you all so much for what you do for us.
you very much again. Now I would like to call our founder and former executive director, Pam Breyer, to come to the podium.
Thank you, Milena. 30 years ago, Maternal and Child Health Consortium began with a vision that all children in Chester County deserve the best start in life. Beginning with the collaboration of prestigious funders, including the Robert Wood Johnson Foundation and many local funders, and many partners here today, including the health department, as Joan Holliday remembers those days too. We began work to reduce disparities in birth outcomes between white infants and infants of color. This success was made possible through the dedicated work of bilingual, bicultural, trusted community outreach workers, women living in the communities where they work to reduce the roadblocks keeping families from getting the care they need. Many staff here today were part of this initial work. Milena, of course, Cecilia, Sonia, Maritza, Annabelle, who continue to work tirelessly today to ensure that families have access to critical health and early learning services for their children. Former colleagues are also joining us today, including Nader Zambrano and Melia Revelo, who successfully led Healthy Start, Health Insurance Enrollment, and the Kennett Family Center. Thank you for all the work that all of you do and did every day. As the founding executive director, I'm proud to see how MCHC continues to grow and evolve to meet the changing needs of families in our communities, to help children start healthy, stay healthy, and succeed in school. I'm confident that with Milena's impressive leadership and the board's commitment to the vision of MCHC, families will continue to thrive in Chester County. The following video was put together by MCHC staff to highlight this commitment. MCHC was started to really help low-income women and children and families get access to care. In 1991, a major prenatal care provider stopped providing obstetric services here in the county. What that did was create an incredible void for low-income women to access care. A group of individuals who were very concerned about lack of access to care for low-income women right here in Chester County got together. They realized there were a number of roadblocks confronting women. A formal needs assessment was commissioned, and that needs assessment really became the basis of identifying the roadblocks that we needed to mitigate. And those roadblocks included lack of access to care, lack of affordable housing, lack of bilingual services for women, children, and their families in healthcare, lack of health coverage. And so those initial roadblocks really determined future programming. Focus when we began was the community outreach worker program called Family Health Advocates. And from 1995, with the initial funding from Robert Wood Johnson Foundation and a number of local and state funding partners, we began. And for a couple of years, we would visit women in their homes, we would connect women to resources, and really make a difference for those families in accessing health care. I think MCHC was one of the first organizations that helped develop trust in the community between staff and the community and healthcare providers. A lot of families were really experiencing hunger So we connected families with the WIC program and children with the Children's Health Insurance Program. We worked with families in their homes. We were able to identify the needs that those families had. And one need many families had, especially in the southern part of the county, where a number of their children did not have the skills they needed to enter kindergarten. And this really developed into the Family Center in Kennett Square.
Over the last 30 years, we started with moms and infants, supporting them, providing services, and have grown to staying with them and helping them grow and develop their families. I'd say what sets MCHC apart and kind of like the premier organization, I'll say within the county, is their purpose and their presence. I would say that's what excites me about this organization, where we're headed.
Some of the trends in the community have changed, and so we have been able to assess those trends and been able to adjust and enhance our programs. And that's one of the objectives that we have with our strategic plan, is to ensure that we're meeting the needs in the community. So the vision really is to enhance the programs in that aspect, to ensure that we're meeting the needs of the community, as well as we really want to increase and expand partnership with other organizations, not to duplicate different services, but actually work together. We have made it far. We know the big positive impact we have made during the last 30 years. And moving forward, we're hoping that we will have more than 30 years to continue making a difference, to enhance our programs, to grow MCHC, like to have more community health workers that can make a difference in the life of the families that we serve. We annually serve over 5,000 individuals, so it will be great within the next 30 years to just serve 10,000 if we can, because we know the need is here, and after the pandemic it's even more.
Good evening, everyone. I'm Lindsay Sweet, and I'm MCHC's Board Vice President. I've been on the board since 2017 and feel connected to so many parts of our mission. Not only the great work that this amazing organization does, but also within my professional career. As an immigration attorney practicing in Chester County and a founding partner of Sweet & Paciorek LLC, I've been defending immigrant rights for the last 15 years, supporting families from the same communities that MCHC serves. As an immigration attorney that works in deportation defense and many humanitarian visas, I often work with immigrant families in crisis, often when families are already at the rope's end. Being part of MCHC has allowed me to work with some of the same communities that my practice works with, but from a different perspective, before the crisis, in hopes that there won't ever be a crisis. From the first time that I heard of MCHC employees being referred to as madrinas, a Spanish word for godmothers, I knew that MCHC as an organization must be doing something right to earn such a title of honor among its clients. When I joined the board, I became more intimately familiar with the holistic, bilingual, and bicultural approach to education and health, and that MCH provides our clients a rare personal approach in a rapidly impersonal society. When Chester County experienced an influx of new groups of immigrants from Latin America over the last 8 or so years, some recent arrivals where Spanish was not even their first language, but instead a Mayan dialect, MCHC was here, ready to pivot, learn, and maintain our holistic approach. To give you an idea of the programs that drive MCHC's mission forward, we're happy to share a video that illustrates just that.
helping families is what MCHC does. The work that MCHC does is make sure that families start healthy, stay healthy, and then are ready for school.
30 years ago, MCHC started as ensuring that women and children have access to health care. The flagship program is the Healthy Start program, where we enroll moms during pregnancy, during the first trimester of pregnancy, and then we have community health workers, bilingual community health workers who do home visiting services, ensuring that moms deliver a healthy baby, and then they work with the mom, the baby, and the family until the child is 18 months.
With the Healthy Start program, we service about 120 families per year, and being able to have those skills and have someone right beside you to really guide you through that process and help you get there, there's no words for what it can really do for you down the line.
When we started seeing a big need, not only with health insurance enrollment, but also with the SNAP benefits, we then had the opportunity to expand the program and create the Family Benefits program.
We make sure that with the Family Benefits program, they stay healthy, not only the child, but the family. If they need health insurance, or they need to apply for food stamps, or they need to apply for food cash assistance, any program that the county gives, so that we can help them with applications. The applications are very cumbersome. They are long. They require a lot of documentation. In each case, the family benefits specialists are really the ones that help all families. Typically, in a year, we do about 1,400 application assistance.
In 2006, we had the opportunity with the state to start providing services under the Family Center program.
And then with the Family Center program, what we do is make sure that they're ready for school. Each family receives twice a month visits, and it's mainly about teaching the parent how to be a better parent. So learning about child development, learning about what the child needs, if there's any reason, because we do screenings, health screenings, developmental screenings, and if we find out that the child might need some help, there's always referrals to and work together with early intervention. You learn from 0 to 5, that's a critical age that children will develop. So we want parents to feel comfortable sitting down and playing with the children and reading to them. When they are ready to graduate the program, so they're usually in the program for about 2 to 3 years. When they are ready to graduate, they usually are entering kindergarten. So we also offer a kinder transition program. And it's amazing to see the children the first day very quiet, some crying, and then little by little it gets more noisy and they're enjoying it and they have friends.
MCHC is important because it really makes a difference in the future and life of many young children and their family members, ensuring that they thrive in life.
Hello, good evening. It is so nice to be here. I'm Cecilia Arce, and I am MCHC's Director of Programs. All our supporters make it possible for us to help children and families in need. We express endless thanks to every one of them. Each year, we recognize specific individuals, foundations, businesses, and partner organizations who went above and beyond to support our mission. Thank you very much. I would like now to welcome up our board president, Elizabeth, to present our first award.
It is my pleasure to present the Corporate Partner Award to Malvern Bank National Association. Malvern Bank has been a longtime supporter and partner of MCHC and of our programs. Through their participation in our collection drives, through opportunities provided for MCHC to network with local organizations, and through various means of financial support. With Malvern Bank's support, MCHC has delivered more services, reached more individuals, and strengthened more families. A special word of thanks is extended to Patricia McLennan, Senior Vice President and Community Development Director of Malvern Bank, for her personal commitment to MCHC's mission and for her support of MCHC's financial resources through the exploration of investment opportunities for the organization. Please join me in congratulating Patricia and Malvern Bank on receiving the Corporate Partner Award.
Good evening, everyone. Just so you know, it's about the first time I've worn heels in 18 months, so those steps are wicked. Good evening, everyone, and happy 30th anniversary to the entire Maternal and Child Health Consortium team. I am pleased to be with you tonight and honored to be recognized as the Corporate Partner of the Year on behalf of Malvern Bank. As many of you know, I served as CEO of Home and the Sparrow for several years. In that role, I met Pam Pryor and I began to watch MCHC grow. At Home and the Sparrow, we share the same concerns, that state data shows Chester County as one of the wealthiest counties in Pennsylvania. Yet, we all know about the pockets of poverty that are 2 to 3 times greater than the overall county rates, where families were struggling to access basic health care and other basic needs. In our own ways and together, both organizations worked hard to make life better for these families. MCHC became one of the 100 Healthy Start programs, and Home of the Sparrow developed innovative housing programs for mothers with children. We worked together with Friends Association and several other organizations. At one point in time, I had the opportunity to work with Elena. Both she and Pam are an inspiration to us all. For the past 5 years, I have been working at Malvern Bank, where I am able to continue to help families in need. Through our Community Development Division, we are able to provide sponsorship support throughout the year. Additionally, through the Malvern Federal Charitable Foundation, we provide grants to many organizations in our market areas. Since the foundation's inception in 2008, we have provided nearly $900,000 in grants. Thank you so much for recognizing Malvern Bank this evening.
Good evening, everyone. Now we would like to give an award to Chester County Community Foundation.
The Chester County Community Foundation has been a long-term supporter of MCHC pretty much since the very beginning. Last year, the foundation provided generous grant funding to meet emergent needs of families in our programs brought on by the coronavirus pandemic. With their support, we were able to equip staff with the necessary tools to work with families remotely from the get-go to ensure that there were no gaps in support for community members in need. I'm ecstatic to present the Community Partner Award to the Chester County Community Foundation. Congratulations.
so very much. Just a few brief words I'd like to say. MCHC has done a wonderful job. The Community Foundation is about 27 years young, and from the get-go, we always found that MCHC was just fulfilling its mission, doing its vision, and just, in the world of nonprofits, an A+. In the last year, the fact that they could pivot and not miss a day during the pandemic was outstanding. And we were very, very glad to be able to help and support and make sure that that transition was seamless. So thank you very much.
I would like to present the Community Impact Award to the Fund for Women and Girls. The Fund for Women and Girls has supported MCHC with volunteer hours, grants, and educational events for many years. This foundation's focus aligns with MCHC's missions to empower women and girls. We have had the pleasure of working with volunteers from the Girls Advisory Board program, as well as collaborations and focus groups to inform services to address birth disparities. I'm happy to present the Community Impact Award to the fund.
Hello, it is great to be here tonight. I know a few people said that, and I'm sure a few of us had to stick it in to zip her up and button up tonight. I know I did. I am Denise Wine. I'm the Executive Director for the Chester County Fund for Women and Girls. Our new name is the Fund for Women and Girls. And I'm joined tonight with our interim executive director, Mary Beth Morrissey, and her daughter, Tara, who does some project work with Westchester University and MCHC. So we're always delighted to have young people interested in the community. I'd be remiss if I did not mention Michelle Sanchez, who is our past executive director, and I'm quite certain we are here today because of the impact that she has had in our community over her leadership at the fund for the last 5 years. So Michelle is onward and upward in her career, and we are supportive, and we are happy, and we are cheering her on. I just quickly want to mention the fund has been a big supporter of MCHC and the work that they do. Over the last 3 years, we've granted over $21,000 in grants to them. And we are just thrilled to watch them as our front line, boots on the ground, getting it done. I'll leave with the words from my 89-year-old father, whose filter isn't so great these days. He says, Denise, just get out there and get shit done. So with that said, MCHC, we want to thank you for 30 years of getting it done. Thank you.
Good evening. I'm going to be presenting the first volunteer award for tonight to Joe McFadden. Mr. McFadden led MCHC's Strategic Planning Committee efforts in 2019. He facilitated meetings and led the process throughout the year. He supported board members with strategic thinking and analysis to develop the direction of the plan, and I myself had the opportunity to be a part of this committee. So it is my honor to present this award to Mr. McFadden for his dedication and support of our strategic plan process.
Sometimes I start out with some expectations of teaching people. Guess what? When I spent time with these folks, I was the one that was learning. Things about the environment here in the community that I did not know, and I began to love the program. So,
Hello everyone and welcome. My name is Sarai and I am the Executive Assistant for Maternal and Child Health Consortium. Part of my role is to assist volunteers and interns with the required paperwork and including orientation training as well. I had the pleasure to work with Lauren for almost a year. She supported us in many ways around the office as well as calling participants, donors, and data entry. On behalf of MCHC staff, we would also like to thank our board emeritus Yolanda Turman for referring her daughter Lauren to volunteer at MCHC. I am honored to present the award to Lauren. She was not able to join us in person, but I would like to share a video she sent to us. Thank you.
Good evening, everyone. I'm so sorry that I was not able to be with you all in person, but thank you so much, MCHC, for this volunteer award. I am so appreciative of all of the experiences that I've had while being a volunteer, and especially during COVID-19. At the beginning, it was very difficult for everyone to navigate, but because of the guidance and leadership of the women in this consortium, I was able to have a hybrid experience and learn more than I've learned through most of the volunteer organizations that I've participated with. I was able to have incredible new experiences and take away so much. And honestly, MCHC has made an impact on my life that I will forever hold in my heart, and that I hope to continue as I move on in my life. And so again, I say thank you so much for this award. Thank you for the experience, and I hope that you all and your loved ones stay safe and well.
And now let's welcome Yolanda Turman.
Good evening, everyone. I am Alma Vidal. I am the manager of the Healthy Start program. On day-to-day, our program staff works closely with crime victim center staff to share resources and support many of the same families over the years. This collaboration has yielded a positive coordination of services that ensures the safety of families facing heavy challenges. I'm pleased to present the Community Partner Award for Crime Victim Center.
I'm Chris Zaccarelli, the CEO of the Crime Victim Center. And first, thank you, Melina, for honoring us at a gala that I didn't have to plan. I mean, come on, it does not get better than that. I also want to give a huge shout out, and please don't tell my sister, she got married in this ballroom and it did not look this good. So the staff at MCHC, amazing job. We are very grateful for our partnership with MCHC. They offer us space in their office in Coatesville where we're able to meet with our clients on a regular basis. And we are just so grateful. And I'm grateful for Melena's friendship and our executive director peer group at the Exton Region Chamber of Commerce. No, you're not allowed to know what we talk about. We are very, very grateful that we are a partner with MCHC to help families start healthy, stay healthy, and succeed in school. Thank you.
You look gorgeous.
Good evening, everyone. I'm Brianna Villagrana, and I am the manager of the Family Benefits Program. Friends Association has been a partner agency since 2019. In addition to supporting our health insurance enrollment initiative, they also contribute in-kind donations for families in our programs. We are grateful for their shared commitment to helping families build well-being and providing opportunities for them to thrive, which is why I'm glad to present this great organization with the Community Partner Award.
Good evening, I'm Jennifer Lopez, the Executive Director of Friends Association. And on behalf of our board of directors, our team at Friends, and all of our neighbors, congratulations on your 30th anniversary, and thank you for this partnership award. Housing and healthcare are inextricably tied together. So it's no surprise that we, Friends Association and MCHC, lean on one another to support the work we do with families. We can't do it alone. It takes all of us, and we're tireless in our efforts. We're really fortunate to live in a community that's united in ensuring that every person has what they need to achieve their highest potential. Whether it's through donating, volunteerism, partnering with local government, or nonprofits walking side by side in this journey, it makes Chester County a really special place. Tonight, look around you. See the builders of your community. Take note of the beautiful acts of collaboration and inclusion. May this be the start of a new world where all families are healthy and housed. Thank you.
So the following award is very special to me, and I'm sure it's very special for many of us here today. I attribute much of the commitment, gratefulness, passion, and professionalism that I have acquired over the last 17 years with Pam Breyer. She has been my boss, my mentor, my guide, my friend, my admiration, and I can keep going and going. I really have no words to express my gratitude, our gratitude, from the MCHC family. Pam, you have been an experienced and trusted advisor. You are a person who is always sharing your experience and knowledge to help us at MCHC, to help all of us. You have inspired us for many, many years to reach our goals. As the founder and executive director for 21 years when you were at MCHC, you have built the foundation that MCHC needs as of today to be able to succeed. Many of us here tonight have learned so much from you, and you are a big part of who we are today, big part of what MCHC is today, and what we offer through our programs to help families in Chester County. You are a person who is really hard to find, and we admire you and appreciate you very much. Again, I eternally thank you for hiring me 17 years ago and 7 months ago. Again, Pam, I feel honored to present this award to you on behalf of MCHC. Thank you, congratulations, and again, thank you for the 30 years of service and what you have been making for our community in Chester County.
Thank you, Milena, very much. I've already made some comments about how we started, but one of the other things I'm very proud of is during the time we worked together, one of the major emphases that I really had was growing leaders. And I'm very proud that when I left, 4 of the 5 senior staff became executive directors of their own organizations here in Chester County. And I think that's one of the important things about leaders is that we grow others to follow in our footsteps. And I think Milena is a great example of someone who's done just that.
And today we also had another award that I will mention. They were not able to be here with us from Vanguard. So this past year, very tough years during the pandemic, we were able to receive a great support from Vanguard. Their staff members assembled baby bundles throughout the whole year, more than 150 baby bundles for the 175 babies I mentioned earlier. And we wanted to recognize them today. But unfortunately, they were not able to join us tonight. So I just wanted to share that with all of you. We now have special recognition and remarks, and I would like to invite to the podium Senator Caroline Comida.
Thank you, Milena. Good morning. Good morning. It's been a long day. Good evening, my friends, supporters, board members, and colleagues of the Maternal, Child, and Health Consortium. I am delighted to be with you tonight. I'm Carolyn Comida, State Senator, representing the 19th District here in Chester County, longtime friend and fan of MCHC. Thank you so much, each of you, for being here to celebrate 30 years of the Maternal and Child Health Consortium and their important work to ensure healthy beginnings and bright futures for mothers, babies, and families in Chester County. And congratulations to all of tonight's honorees. Thank you for your invaluable contributions to our community and our kids. For 3 decades now, MCHC has been a fundamental resource for families throughout our area, especially those in underserved and underrepresented communities. By helping new parents learn and receive the support they need in a safe, welcoming, bilingual, and bicultural environment, MCHC is making a difference. Through programs like Healthy Start, which educates and provides resources for new families for healthy lifestyles, the Family Benefits Program for health care coverage, and much, much more, MCHC is making an impact. As a society, some of the most important work we can do is supporting our young families and children. You are making transformative and generational change in the lives of families and children across Chester County. In addition, as a member of the Women's Health Caucus in the Pennsylvania Senate and House, please know that I'm firmly committed to advocating for quality, accessible, and affordable health care options for all families. Thanks to the funds from the American Rescue Plan, Pennsylvania now has a unique opportunity to expand Medicaid coverage for new mothers under the opt-in PA plan. I hope you've heard about it. If you haven't, I'm going to tell you a little bit about it. Pennsylvania will be able to expand the Medicaid postpartum coverage period for mothers up to 1 year following the birth of a baby. Previously, coverage was available for only 60 days. So this is huge, as you know. Yes, it deserves a big round of applause for our moms. According to the Pennsylvania Department of Human Services, this extended coverage will go into effect in Pennsylvania April 1st of 2022. That's next April. As you know, the first year postpartum is not only a vital period of development for babies, but it's also a significant time for mothers recovering from childbirth and adjusting to new challenges. Nationally, 22 deaths occur per 100,000 live births per year, tragically one of the highest in developed nations. Meanwhile, the maternal mortality rate is 3 times as high for Black women compared to white women, nationwide and in PA. This highlights a concerning trend and one that does not even account for the impacts on maternal care since the start of the COVID-19 pandemic. The extended Medicaid coverage means that Pennsylvania mothers can access vital medical care like screening and treatment for chronic conditions, mental health services, breastfeeding support, preventative care, substance abuse disorder treatment, and access to family planning services for a longer period of time without worrying about the cost or the need to change providers. It is a big step in the right direction, but our work is far from done. When new mothers and families are provided with additional resources and additional increased access to care, we are helping ensure that our children grow and thrive in a healthy and safe environment. We are putting them on the right track for success in school and work and life. We are giving them an opportunity to reach their greatest potential. That is the very least we can do, and what every child and family deserves. MCHC is a crucial part of that community-wide effort. Your staff and volunteers are working on the front lines of this maternal health crisis and working to ensure that families have access to quality care, preventive care, and other important wellness services. Thank you so much again to MCHC for all your ongoing efforts and good work to serve new families. Congratulations on 3 decades of service, for all your wonderful work benefiting families now and into the future. Please know that I will continue to be a strong advocate for prenatal, maternal, postpartum, and overall health care in Pennsylvania. So congratulations, MCHC, on 30 years. The Chester County delegation from the Pennsylvania Senate has a citation. Elena, perhaps we could give it to you. And could I invite my friend and colleague, Senator John Kane, to join me? My friend, Senator John Kane.
Thank you. So I'm good at posing.
So there are 4 senators that represent Chester County. Senator Kane, Senator Muth, Senator Carney, and myself. And on behalf of the Chester County delegation, Milena, all the volunteers, board members, good workers at MCHC, thank you for 3 decades of caring for moms and kids and families in Chester County. I also wanted to mention that for each of the honorees tonight, we have citations from the Pennsylvania Senate, Pennsylvania House, and Chester County Commissioners. And could I introduce my friend, Josh Maxwell, Chester County Commissioner. Josh is over there in the corner. Thank you for being here, Josh. Pam Breyer, will you come up one more time, please? Volunteer Award for Lauren Turman. And Joelle Madden. Adheres. And the fund for women and girls. And the Chester County Community Foundation. And the Malvern Bank, will you come up again, please? And Dan Gard was not able to be here, but we thank them so much for their support, and we'll make sure they get their citations. Thank you, friends.
And now I would like to invite Nelly Jimenez. She's bringing a message from Governor Wolf.
So hi everybody, did I lost you? Happy birthday MCHC, can you repeat it? Again, happy birthday MCHC. Cumpleaños feliz. Hi everybody, my name is Nelly Jimenez and I am here representing different groups, okay? But the first one is that I am an alumni from MCHC. I worked in MCHC for 10 years and actually I was with Pam and all the team. I was able to open the Kenneth Square Family Center. So I was the first director there, and I was 10 years with Marisa. Marisa, wave. Family Center. So we did a lot of work there. So MCHC is always gonna be in my heart. I wanna recognize Leanne Sullivan, who's sitting over there. She got us a lot of money. Woo-hoo! And also Neidari Zambrano, who also happens to be my sister. Neidari, wave. So we worked together for many years in MCHC, and we really, MCHC has always been in our heart and always will be in our heart. And what better way to see the growth than with Milena last. Milena, I love you, I admire you. You guys have no idea how much this woman works. Hours and hours. I have seen her in my house with her computer working while everybody else is having fun. So Milena, to you, I take my hat off and congratulations. So the other role that I'm playing today, I am also a commissioner for our governor of Pennsylvania and on Latino affairs. So I do affect and make sure that our governor is up to date to the issues that affect Latino families around the state. So sometimes I'm here, sometimes I'm hearing from Pittsburgh. So I have the honor to hear what is happening. And of course, when we were gonna celebrate the 30 years, I told the governor, you need to send a special message to my people in Chester County, to MCHC, of course, to Milena. So that's why I'm here. So greetings from the governor. It is my pleasure to join with the Maternal and Child Health Consortium of Chester County to welcome everyone gathered for the 2021 Fall Gala celebrating 30 years of serving our community. It is among our Commonwealth's highest responsibility to ensure the well-being of our fellow citizens. MCHC, in collaboration with its partners, proudly serve underprivileged children and families in Chester County by increasing health awarenesses, access to services. MCHC exceptional commitment to provide resources and support empowers individuals to improve not only their own life, but to strengthen their communities. Our Commonwealth thrives when citizens work together to provide services to those in need. I am certain that this organization and its members will continue to foster positive social change for many years to come, and hopefully under your leadership. As governor and on behalf of all of the citizens of the Commonwealth of Pennsylvania, it is my honor to congratulate Maternal and Child Health Consortium of Chester County on 30 years of service. Please accept my best wishes, continued success. Tom Wolf, Governor of Pennsylvania. Thank you.
Thank you, Nelly. And now I would like to invite to the podium our Gala Chair, Allison Richards.
Well, good evening, everyone. My name is Allison Richards, and I'm an MCHC board member, and I have the honor of being the Gala Planning Chair. I hope you all are enjoying tonight's celebration with us. I would like to present a short video that we put together few months ago to reflect the daily impact of our home visiting staff.
Es como mi mamá sustituta.
Okay.
Por ejemplo, en el mes que va mi bebé, ¿qué es lo que ya tiene que hacer? Eso yo no sabía que era como por meses y si no lo hace tiene que tener ayuda. Gracias, mis bebés han estado bien desde un principio, no han necesitado como terapias ni nada, pero yo he visto que en el programa todo eso te ayuda. Entonces, siempre una ayuda es buena, porque a lo mejor iba yo a estar preguntando a toda la gente.
So the Healthy Start program is a home visiting program where we try to target the early first trimester of pregnancy so you can start healthy, stay healthy, and succeed in school.
Bueno, para empezar, a mí en lo personal me ayudó cuando yo fui mamá por primera vez, mamá primeriza, me dio depresión postparto. La persona con la que estaba yo en ese entonces me hacen un examen y todo y ahí ya me dijo que tenía yo principios de depresión postparto. Y pues sí, yo noté un gran cambio en mi persona, en cómo me sentía. Porque como te comento, yo aquí no tengo familia, no hermanos, no mamá, no nada. Todo era nuevo para mí. Luego con un bebé pues todavía era más. Entonces el programa me ha ayudado. Depresión era como que todo era un problema, ¿no? Todo en mi cabeza era un problema. Entonces el estar con una persona y a lo mejor sabes que por su trabajo no puede ir y contarle a alguien más. Entonces en esa parte te da la confianza de tú contarle lo que estás pasando. Porque pues prácticamente no tenía yo nadie con quien hablar, ni pareja, nadie. Entonces fue difícil, pero el programa me ayudó en esa parte a mí en lo personal.
I really enjoy doing what I'm doing because when I was carrying my 3 children, there was no one there to give me that support. To know that someone is there concerned about me, to know that someone is going to come to my house and sit with me and explain to me all it takes from pregnancy to when the baby's here is huge. MCHC is actually preparing these little babies to grow to be someone in the future, and it's our future. We have to think about that, you know, it's our future, so it's the only way that we can make it happen.
We hope that you will consider a financial contribution to support this work and help us carry out our mission into the future. Please know that with every dollar, it goes directly to funding our mission to empower and advocate for pregnant and parenting families to achieve healthy beginnings and a bright future. Thank you for making our world a better place for families in need. As a reminder, there are QR codes on the table in the black frame if you'd like to make a contribution. We also have the giving tree, that beautiful, beautiful giving tree in the back with different QR codes that you can scan to make a donation as well. Or if you'd like to do it in cash or with credit, we are taking them up front as well. With that, we would like to now announce the winners of our raffles and our silent auction items. So I would like to bring up Rebecca Pulse to do that for us.
All right, this is the fun part, right? Just one more time, I just want to extend a thank you on behalf of the board and the staff to our donors, both our business and individual sponsors, and to all of you for taking the time to be here with us tonight and support and join us in making a positive impact on communities across the Chester County region. Let's get to the fun part. The winners. I'm reading these off my phone, hence the reading glasses. I'm going to start with the raffles. There were 13 raffles. You can go out to the atrium and claim your prize once I read your name, but I would sit still because we have a couple of duplicates. So, raffle number 1 was Kelsey Gardner. Raffle number 2, I hope I'm saying this right, is Mohi. And if you say it right, yay. Raffle number 3 is Norma Villagrana. And raffle number 4 is Ada Garcia. Raffle number 5 is Phoebe Kitson. And hold on, number 6 is Patrice. Number 7 is Patrice. And number 8 is a lucky Patrice. You're lucky. Number 9 is Bill Gale, as is number 10 is also Bill. Number 11 is Phoebe Kitson. And number 12 is Tiffany Cook. And number 13, the final raffle, is Danielle Gonzalez. Congratulations to all. You can never say I don't win anything. All right, I'm going to move on to the others, the cakes, and some of the other items, the donated items are all mixed in together. We've got a couple of cake winners, starting with the apple dulce de leche. That's Don Volpe. The almond vanilla pear cake is Annalie Cornigo. The purple carrot cake is one of our fearless leaders on the board, Elizabeth. Hold on, Elizabeth, you're not done. The carrot cake with cream, cheese, and vanilla is Alma Vidal. And the carrot cake with cream cheese icing is Javier Arce. We had 2 chocolate cakes, chocolate ganache and chocolate vanilla ganache. Elizabeth got both of them. The Nutella cake goes to James Otten. Moving off the cakes, we have the custom room painting went to Bruce Eaton, and the Yellow Springs package also went to Bruce Eaton. The Limoncello and Pietro's Prime basket also went to Bruce Eaton. Not a lot of raffle tickets. The Fogo de Cacho basket is Annalie Cornell. The Wegmans basket is Phoebe Kitson. The Marsh Creek Water Sports basket is Robert Lisowski. And we have a couple of Mary Kay baskets. We have 3 of them. The first 2 both went to Annalie Cornell, and the third one to Phoebe Kitson. The Flyers tickets went to Denise Wine. 2 more cakes. The raspberry vanilla cake went to Annalie Cornell, and the strawberry vanilla cake went to Christine Hesse. And that is all of our winners. So great donations, great winners, contributions, congratulations. Again, you can go out to the atrium to pick up your prizes. And just again, that concludes our program for the evening. So thank you so much again for being here and celebrating with us. Feel free to stay. We have the room for a little bit longer. And cheers to